So Miss Lyons is a 70-year-old female currently an outpatient receiving IV antibiotics for cellulitis. Healthcare team is concerned about her understanding about when to seek help regarding infections. I'm Brian, I'm a student nurse. I'm going to talk to you about your current condition.
So just to clarify, you can all see me, right? Now I can see and hear you. And there's Andrew.
Yeah.
Hi, Andrew. It's your grandma.
Hi.
I can see you perfectly.
Okay.
What is your understanding about diabetes and how it's associated with wound healing?
Well, I know I have diabetes, but I don't really know how that affects my skin. Like I thought I just had a little scrape and now I have all these IVs and I don't like it.
In diabetes, you get less blood flow because excess blood sugar causes narrowing of the vessels. So you get less oxygen, white blood cells, and nutrients to the tissues. This causes wounds to take longer to heal. People with diabetes are more at risk for infections because the white blood cells aren't functioning properly. So what is it you know about sepsis?
Is that the name of a ship? I don't really know what that is.
Not quite. It's a response of the body to infection. So in this case,
Oh.
it would be cellulitis on your leg. If you don't treat the infection on your leg in a timely manner, sepsis can quickly occur and eventually cause tissue damage, organ failure, and even death. You want to look out for early signs, which are fever, confusion, clammy, sweaty skin, shortness of breath, or even high heart rate.
Oh.
Another problem with diabetes is a decreased sensation in your legs. So it makes it easier for wounds to go unnoticed. So it's important you check for any injuries daily and assess for infection.
Hi, Ms. Leon. Today we'll be discussing about skin assessment, and said it's really important for you to look at your skin at least once a day while you're getting ready. You need to look for any redness, any scrapes, open sores, blisters, or cracks in your skin. You want to see a doctor. Once these sores have pus-like discharge coming out of them or they're not healing as they used to, you need to book an appointment and see a doctor as soon as possible. Don't try to walk barefoot on the ground because you have decreased sensation in your feet. So you need to wear good fitting shoes and socks because you don't want to have any pressure injuries. Katya, she'll explain you a bit more about the website which you can use.
Are you using your personal computer right now?
This is just a computer Andrew brought over for me. I don't actually know how to work it. He got me on this this meeting here, but Andrew's gonna have to help me with that.
Okay.
That's all right.
I'm going to show you actually one internet resource today, and Andrew can help you maybe navigate it a little bit more later. This is the Diabetes Canada website, or www.diabetes.ca. It has lots of accurate, reliable information. If you have any other questions about your diabetes, it gives you also nutrition information. This is going to help you prevent future complications that could occur. And I'll show you here that there's also a tab for local programs and events. So if the internet just really isn't your thing, there are places that you can go in person to get more information.
That might be good, Andrew.
Yeah. I agree.
If you have difficulty navigating this stuff over here, you can type in the search bar. So I'll just show you. You can just type in recipe there, and then there's lots of different ones to choose from. There's pictures.
Get me to this page, Andrew. I want to check that out.
Yeah.
Right, so hopefully you can find that useful.
So now, just in order to make sure that we conveyed the correct information to you, we're going to ask you a few questions. Can you tell us what you understood about the connection between the diabetes and the wound healing?
So you said that with the diabetes, I don't get as much, it narrows the blood vessel or something. So I don't get as much blood flow to my skin or the tissue, and that makes it harder to heal. Is that kind of what was going on?
Yeah, exactly. That's what happens in the body. So the blood doesn't reach to those like feet properly. The next one is what are you going to do each day when you're getting ready for work?
Oh, looking at the skin. Right.
Yeah.
So I will make sure I look a little closer. I always just thought those little scrapes were just going to heal because they always did. But I understand with the diabetes, it makes it harder for them to heal. So I will take a look.
And when will you go and see the doctor?
I will go see the doctor if anything gets infected, or if I notice, what was that called again? The sepsis?
Sepsis?
I'll go see the doctor if I see anything like a fever, or I'm feeling chills or things like that.
Yeah, so if you have any shortness of breath or you have any other those problems, just go and see a doctor as soon as possible.
Okay.
Do you have any other questions regarding it?
No, I don't think so.
Okay, if you have any other concerns later on, you can always call us at our clinic on the number which is given here on the pamphlet.
Okay.
And we'll see you in 3 weeks for your next appointment.
Okay.
Sounds good.
Thank you.
Bye.